Then after that, we moved to Mid-City, the campus that you all would think of as the old Baton Rouge General. And then we opened up the Blue Bonnet Hospital in the 1900s. That Mid-City Hospital was opening in the 50s. In the 1990s, it was Blue Bonnet, and then Ascension we opened in 2018. So it's been a progressive, growth of the system over all these years. But really the closure of RK Long and the transition of that charity system, along with the closure of the emergency room at Mid-City, really was a huge change in the landscape of healthcare in this community. However, that hospital at Mid-City remained open, even though we didn't have an emergency room and our clinical activity on the acute care side diminished. The hospital was still open. I think at the lowest time in terms of employment, we probably had about 800 employees there, and now we have closer to 900, 950 employees there. So it's a thriving hospital. We shepherd that hospital through that transition, moving from acute care to what we call post-acute care. So sort of more of a nursing home type environment. We did a lot of behavioral health associated with that, and we had a plethora of outpatient activities there too, from rehab to radiation oncology and primary care and a variety of other things. So it was a very, very good facility. But my goal was always to figure out ways in which we could open that emergency room again, and how we could open also the acute care side of the business again. And Medicaid expansion was a huge sort of boost for us to be able to accomplish that dream. And then we had COVID. And so the confluence of all of those things, the governor asked us, could you open Mid-City as a surge hospital? We took a look at it. His team came, and indeed we reopened it as a surge facility for this community. And it's awful, okay, as COVID has been for the world and for the state and for Baton Rouge. There has been a silver lining there, and that is that we were able to reopen that acute care facility and that emergency room. With the support of the governor and the Louisiana Department of Health, we were able to fast-track approval of that emergency room. A lot of teamwork on the part of our team and the team from the state. And so we reopened acute care, we reopened the ICU, and we reopened the emergency room. And if it wasn't for that facility at Mid-City during the peak of the last now 5 waves of COVID, it would have been extremely difficult for the hospitals in the region to be able to take care of all of these patients. So we're very proud of the role that we and that Mid-City facility has played as a surge hospital. We saw over roughly 37,000 patients, half of them from some of the zip codes in the area that are the most in need. But we have outpatient surgery there now with a joint venture with with surgeons. We do a lot of cancer care, behavioral health, like I was talking about before. Many people don't know we have a reference lab there. A lot of physicians, not only those who belong to the general network, but other private physicians use the reference lab that we have at Mid-City. There's diagnostics there. We just opened a high-risk breast clinic, a lot of primary care, mammography. So anyway, the list goes on and on and on. And now we have this full-service emergency room there that could see everything from broken bones to heart attack. The big question is, how sustainable is this? And was this just something that we did for COVID? And the answer is that a lot of it is going to depend on Medicaid reform and payment reform. And that's an interesting topic in and of itself, because different hospitals get paid differently at different rates for the same care. And what we're pushing for is a level of equity between the various hospitals in the state to make sure that Medicaid is paying everyone fairly, so that hospitals like Mid-City don't bear the brunt of the pressure of reimbursement. And obviously, between the lines, what I'm saying is that the hospital of Mid-City gets reimbursed less than other hospitals in the area for Medicaid. So we're working with the governor, we're working with the Department of Health to correct those those issues and make sure that the payment mechanism is more balanced. So that's topic number one. Topic number two is workforce development, and staffing has been a huge challenge. Before COVID, we already were in a challenging environment. Just COVID made it significantly worse. We have nurses. Just a week and a half ago, we had, in a period of about 2 hours, we had about 6 nurses resign to go on these travel jobs in Minnesota and so forth, earning a significant amount of money. And of course, you can't blame them. They're young, they're mobile, and this is an opportunity for them to make additional money, but it puts a tremendous amount of stress on the hospital system. So, and it's not just a problem with the general. All the hospitals in the United States are facing that problem. A lot of nurses have retired. Others have moved to less stressful jobs, and so what do we do about it? What can we do about it? Short term, we do the things that other hospitals do. We also hire travelers. I mean, they leave us on one hand, and on the other hand, you have to rehire others to come in. We have incentives for retention of the staff, et cetera, et cetera. But longer term, we're trying to figure out what is the solution so that we increase the supply of clinicians and particularly nurses in the area. So Mid-City has 2 nursing schools. A lot of people don't know that. We have a diploma school, which is sort of like a certificate school, and that's originally how nurses were trained. Hospitals trained nurses in the late 1800s when this process started. And our nursing school at Mid-City has been around for decades, on and off a few times. But initially, it was founded in the early 1920s. There was a lapse for a few years, and it was reopened again in the 60s. And we are the only certificate or diploma school in the state of Louisiana, probably one of maybe 20 left in the United States. But we love it, because we're able to work very closely with that curriculum and with the training of that nurse, so that at the end of only 18 months after their requirements, they can actually come work for our hospital or any hospital. Obviously, we want to hire as many of them as possible. So, and we also have a 4-year degree school in collaboration with William Carey. And so that nurses who want to have a BSN can go through that process, or if they have a diploma, we have a relationship with William Carey so that over time they can get their BSN if they need to. Interestingly enough, the pay doesn't change whether you're a diploma nurse or whether you're a 4-year degree nurse. Everybody goes through the same testing, the same training. My bias is that these nurses that come through our program are actually better trained because we have a lot more clinical hours for them, and of course they acclimatize to the culture of the general, and so we've worked really hard to retain that school, and actually our goal is to double the number of nurses that we graduate. Our goal is to eventually get to about 120 nurses a year that we're graduating there. We're adding a very interesting twist to this workforce development issue, and I think you may have read a little bit, or you may have written about it too, on the partnership between the general and the school system for Park Elementary. And what we're doing, in essence, is we're creating this medical-focused school that allows parents to choose a school if they want their kids to be exposed to the healthcare environment, in terms of jobs and training and so forth. And I wanted to start from kindergarten, because by the time kids are in their 8, 9, 10 years old, they're already set not only in their traditional math and English, but also just in terms of cultural development and cultural affinity in terms of what it means to be of service at the hospital. So we want to catch the kids as early as possible, and then over time we're going to work with the school system to develop curricula, to embed our staff into the school, to give opportunities to these kids to actually either work or volunteer, have internships at the hospital, and over time we'll develop it all the way through the high school process. And ideally, at the end of high school, maybe some of the prerequisites for the nursing school will have been completed, and we can get these kids right into nursing school, or it could be pharmacy school, or it could be radiology school. We'll have a variety of opportunities for them. and hopefully at the end of that with a guaranteed job at the end of their training. So we're very, very excited about this. I hope that the General could be a model for other businesses that are interested in figuring out how to work with the education system so that these kids after graduation have a job. So it's all, kind of focused, and the aim is, employment at the end of their certificate process. And because we're a hospital, we hire everything from PhDs to folks that are helping us in the nutrition area. And I hope that we can offer, again, a wide variety of opportunities for these children. I know that Park is elementary is an F school right now, and that's a challenge for us, but we can only go up from there. And that's why it's so important for us to get really involved in not only in the governance of the schools, but also in the day-to-day activities of the schools, so that we can be true partners in a very, very meaningful way with them. We're working very hard with Dr. Nassis to make this a reality. The vote happened last week, and we got approved for the school at Park, and soon we'll start working on the high school piece. But again, I really hope that this will be a model for other employers in the area. And somebody's going to tell me how I'm doing with time, because I didn't start my timer. All right. So economic development. Blake Patterson, the Advocate, had a front page article that talked about Mid-City as a beacon for the area, and it's really apropos because that is exactly what we've attempted to do at Mid-City for many, many, many years. The business report has written about the importance of Florida Boulevard and Florida Street as a major artery for economic development, and many of you know that the General was founder of Mid-City Redevelopment Alliance, really with the goal of improving quality of place in the area and overall development in the area. And we continue to work very closely with them and with other key stakeholders in the area, from for property owners to the Baton Rouge Area Foundation to the mayor, to really revitalize the area. Move BR is going to give us an opportunity to rethink what Florida ought to look like, and to that end, we've worked really hard with property owners and with BRAF and with architects and urban planners to figure out what ought to be the flavor of what we're calling that medical corridor that goes from some of the clinics that are to our west of Florida all the way through to Baton Rouge Community College, which will eventually, over time, I think they're planning to have their nursing school over there. So you will have 3 nursing schools in that medical corridor. But the idea is, how do we revitalize and how we use the current resources to make it better? For us, our part includes redoing our front entrance. We have a parking lot there with a fence right in front of Florida. We want to open that up. We want to turn the parking area into a green space that could be a community space, not only for the hospital and the patients, but for the community. And hopefully with the resources in redoing Florida, we're going to have a really, really interesting and cool destination, a place for the city. And I think more importantly, as we think of the role that a hospital plays in taking care of patients, we have a unique opportunity at Mid-City right now, the Mid-City Hospital, because we're also going to be healing the city. Think of Florida as a dividing line between north and south, between white and black, between poor and rich. And we have got to figure out a way to build Florida as a bridge between both areas, rather than this separating line that we have right now. For example, it's very difficult to cross Florida walking, or even if you have a car. Maybe you can do Acadian and a couple of other streets, but other than that, it's very jagged. And at times I'm wondering, okay, was this done on purpose, or was it by chance? But the reality is, it is there that way, and we have an opportunity now to kind of redo that and opening up that line of communication. And I think the Mid-City Hospital is going to be at the center of that model that I think will be really good for the whole city and hopefully the state and others. There's going to be a lot of planning, for that, and a lot of opportunity for input from a variety of stakeholders. But our vision is we're very excited about it, and I think that that it'll be a shot in the arm for Mid-City Hospital, but more importantly, a shot in the arm for this for our city. Other areas of growth for the General. We opened the Ascension Hospital. That is a sort of a micro hospital or a neighborhood hospital. It's the first time that we have done one of these, and it's probably going to be a model that we're going to be duplicating over the next several years throughout the region. In fact, we're already planning about a couple of potential additional locations. But we did that. We've opened about 8 clinics, anywhere from Central to Zachary to Shenandoah. These are outpatient clinics of our employee physician group. We founded a robotic surgery institute, and I just saw some recent data. We're top 10% of the nation in volume. Our little hospital at Bluebonnet is 10% of the nation for robotic surgery, and 10% in safety and quality of its outcomes. And not only do we have the general surgery robot, and we have 4 or 5 of them, I've lost track, but we have one specializing in orthopedic surgery, and we have another robot that was our most recent acquisition that specializes in diagnosing long lesions. And in the future, we're going to be able to treat directly to the lesion with this robot. And so pulmonary doctors and thoracic doctors are very excited about that opportunity. And finally, at Bluebonnet, we opened a brand new outpatient surgery center to help us with the volume at Bluebonnet. So lastly, let me talk about the partnership between the Pennington Cancer Center and the Mary Bird Perkins Cancer Center. When you get cancer, or when a loved one gets cancer, your world goes upside down. Emotionally, you're on a roller coaster, and then mentally, intellectually, you're trying to figure out, what doctor do I see? Do I leave Baton Rouge? And so on and so forth. It's a very, very difficult process to go through, and the decision about where to go is key in that process. That's sort of your first step. You were diagnosed, and now you're going to pick a doctor, you're going to pick a facility. And I think that this partnership between the Mary Bird and the Pennington Cancer Center is great news for these patients and for these families. And it's really going to be a game changer. It's going to be a game changer over the course of the next 10 years, because you're taking the 2 premier cancer institutions in this region, and you're saying, we're going to work together. We're going to avoid duplication where it needs to be avoided. We're going to help each other with back office operations and things that are behind the scenes. And we're going to give our families and our patients in this region the best choice possible for cancer care. And then in addition to that, if you layer onto that the partnership that we have with the Mayo Clinic Care Network, and the opportunity to open up additional clinical trial studies, to open up additional tumor boards, to be able to get a second opinion on the fly without additional cost to the patient and to the family, to get the reassurance that the physicians are actually on the right track, or to change if necessary. I think is going to be a phenomenal opportunity and a phenomenal change in the marketplace that we haven't seen to this date. I think that that partnership is important in really solidifying some of the things that I've been talking about. Here you have an independent institution like the General, with a local board who eats and drinks and is merry or sad here in Baton Rouge. These are our neighbors. They're your representatives on the board. We don't answer to New Orleans. We don't answer to anybody in Nashville or Wall Street. It's us making this happen. And if you think of what I've talked about earlier, how do we open or reopen Mid-City? It was a partnership with the state of Louisiana to reopen that hospital. what we're doing with the school system. It's a partnership with the school system. And what we're doing with the Mary Bird right now is a partnership. And so, I think it's just, to me, we have been here for 100 years. And I think we are just laying the foundations now for the next 100 years. And these are 3 examples of what we have been able to do to accomplish that. We love Baton Rouge, and we love the people of Baton Rouge, and we're just ready to be here for another 100 years. I hope that all of you will walk along that path with us, reporting, asking tough questions when they need to be asked, but really helping us remain sort of a basic institution in Baton Rouge, like we have been for the last several decades. And I look forward to my career ending, I don't know how many years from now, and being just satisfied with what I've seen as a foundation for those next 100 years. So thank you so much for inviting me, and I'll be happy to answer any questions that you have. I did turn my phone off, so the marketing department can't text me the answers, so it'll be very genuine. So thank you again. Appreciate it. Yes.
When you talk about nursing shortage, how much have wages increased for nurses in recent years? And is there room? I know you can only raise wages so much. So is there room to continue to increase wages to attract and retain?
So the question is about the nursing shortage and the impact of wages, and how much leeway do we have in continuing to raise wages. On average, if you just look at long-term, nursing wages could go anywhere between 3 and 7% a year, and it depends on the year. This year has been a lot more than that. We've had to do a lot of incentive pay. Just to give you an idea, the hourly rate that they were paying in Minnesota for these travel nurses was $250 an hour, plus travel, and I shouldn't publicize this because now everybody's going to be calling. But the point being, it's just astronomical, right? It's very, very difficult. Even locally, some hospitals were paying in the midst of the other waves in the order of $90 an hour just to retain the nurses. And so it's very, very, very difficult. The problem, of course, is that we can't go to Blue Cross or Medicare and say, hey, our labor costs just went up 20%, give us more, because Blue Cross is not going to turn to the employer and say, hey, we got to pay nurses more. It's very difficult. So what we need to do is rethink the model. And I think that's where the opportunity is. We're using a lot more LPNs than we did in the past, for example. And that has really helped, reduce our labor, force, our labor problem. So I think it's a matter of you can only do so much with pay raises because the competition is so fierce, and you simply have to develop ways in which you're retaining these nurses, whether you redo and rethink the care model. For example, that's one way of making it, making that happen. Yes.
First of all, thank you for all the work you've done. Also, I want to applaud you for all the workforce initiatives that you're taking at your organization. But if you could step back and give advice to the governor or the legislature, since they have a lot of money right now, is there any changes that need to be happening in your education, K-12, higher ed, or licensing, or if you had an extra $50 million the governor can spend, where would you like to see it?
All right. So the question is, what is the role of the state and the governor in alleviating this, workforce development issue? Where are the roadblocks? What are the bottlenecks? And if I have $50 million, where would I spend it? And so I think that there is a lot that the state can do in reducing and breaking the barriers related to regulation. Let me give you an example. I mean. Part of the reason why we're not educating more nurses, and why we have a waiting list of people trying to get into nursing school, but we can't educate them. And I think Baton Rouge Community College, Chancellor Smith was telling me a few months ago that they turned down something like 600 qualified applicants because they just didn't have a place for them. But part of the problem is that schools can't hire but a certain percentage of part-time teachers. And these teachers need to have a master's degree in nursing. Not any master's degree. Like if you have an MBA, you can't teach, and you're an RN, you can't teach in the school. There are these regulations that preclude and make difficult the ability for the schools to grow faster than what they're growing right now. And that's strictly a state and federal regulatory issue that needs to be addressed. If I have qualified nurses who are wanting to teach at my hospital but don't want to teach full time, there should not be a roadblock for these nurses to be able to teach. The same thing with the requirement for a master's degree. You really don't need a master's degree to teach in nursing, in my opinion. Of course, others would beg to differ. But if you're a good clinical nurse and you have the ability to teach and the desire to do it, you ought to be able to. So those are a few examples of what needs to happen. Now, in terms of investment, yes, I think the opportunity is to really begin to have some of these dollars flow into these various nursing schools that we have throughout the state. And I would argue too that the renaissance of certificate and diploma programs for a variety of professions is critical. And we're in the beginning of that renaissance here, and all of you will be reporting about this in 5 years. I think it's going to be a phenomenally good move that our school system in Baton Rouge is moving toward, and also at the state level. So I would definitely take some of those $50 million and invest it in the educational system, but also in the non-traditional sort of education certificate programs that are out there that I think are very, very innovative and can have a much more significant dent than simply funding 4-year schools. Did I miss any? Good? Okay. Barbara?
I was going to piggyback on that. So do you or any hospital have a presence at the C-Tech school in East Baton Rouge Parish?
We have, I don't have a presence there right now. We visited. They know that we're a potential opportunity for them. Our goal has been more, and what we have done is that we have partnered with one high school, specifically the Medical Magnet High School. And I forget the name, Glenwood? Glen Oaks, okay. And so there's a lot of connectivity there, and that's working very well, and we hope to do the same thing with Park Elementary. So, but we don't have a specific program with them right now, and I know that Acadian Ambulance has been involved with that program, and yes.
Since it draws students from all over the parish and not just one high school, it would be a good one to explore with
it would be.
The superintendent.
Yeah. Great. Thank you. Yes.
2 questions. What's kind of the timetable for y'all making those changes at Baton Rouge General Mid-City in terms of like the landscaping and everything like that, kind of opening up things? And also, what areas are y'all looking at putting these smaller hospitals in, like y'all did over in Ascension?
Oh, okay. I can't give you a timetable on our plans for Mid City. Obviously, I'd love to do it like today.
Yeah.
But I can't. It's an expensive proposition. We're working with our foundation to figure out ways in which we could finance the program. We certainly want to time it right with the changes of MoveBR that MoveBR is doing, and the changes that we're coordinating through the mayor and through BRAF for all of Florida. And so I think at the latest it'll be a couple, 2-3 years, and hopefully sooner than that, because I want our hospital to be in a sense the initial step, so people would see that it's possible and would see what is possible. But right now it's strictly a financial issue for us. In terms of where we're thinking about putting additional neighborhood hospitals, I also can't tell you because we're in the midst of looking at property, and if they find out we're looking, the price will go up. So, but at least a couple of locations over the next couple, 2-3 years. Yes.
To the point of the neighborhood hospital.
Yeah.
So recall correctly, a few years back, General and Oxnard seemed to be in conversation with a possible partnership. And to my knowledge, I don't see it where that went forward.
Right.
So, but I see them and others as an expansion of urgent care facilities and physical buildings off of I-10. Is there a point where there's too much?
The question is there a point where your geographical expansion, both the general and others, would be too much, and in a sense we would be malinvesting capital? The beauty of the free market is that entrepreneurial spirit of the various companies eventually will figure out is there return of investment there or not, and some investment might be a malinvestment, and it would be clear at the time that we're overbuilt and we would stop. I always say that the reason why we need to expand is if I'm full at Bluebonnet and I have still opportunity to attract physicians and patients, but the beds are empty at some other facility, I still need to expand in order to be able to service those patients. So I do think that you could argue that the Baton Rouge is overbedded. I would say, well, it's overbedded, but it's probably the beds are in the wrong location. So how do you change that? Well, you can't change that. The way you do it is that you invest capital in expanding your facility, and eventually, because at one point, I'm talking about in the 90s, the Bluebonnet Hospital was struggling. The cash cow was Mid-City. But the CEOs and administrators and the board at the time had this vision of what Bluebonnet could become, and it took several years for it to happen. So one could argue that Bluebonnet was malinvestment in a sense, but the reality is that it saved the general in terms of its ability to continue to grow, because the population was shifting, and you all know the story. So it was important for us to be able to do that. The answer is yes, but who knows when and at what level.
Does it come back to, in the private sector, it is, if we have a variety of companies providing a similar service, the market's going to dictate.
It's going to dictate
who provides the best service, and hence everyone's going to.
That's exactly
so
that is exactly how it's going to work, because you could argue that there's that we have eBay and we have Amazon, and that's too much, but the reality is that they're competing for the business. So it's the same thing with the healthcare environment, and one could argue from an ideological perspective that wouldn't it be better if everybody was under one umbrella and we would coordinate things better, but we all know how that story ends. And so it's a very delicate balance with healthcare. Employers are paying for this. But I don't necessarily get paid more because I decide to expand. I have to compete within the rates that the market is dictating, right? So it is a little bit of that sort of the free market spirit that I think is what makes our healthcare system in the U.S. different, and I believe better, with all its negatives, but I believe better than in other countries, Canada or Europe, et cetera.
So is there a medical facility somewhere outside of Louisiana that the general follows itself after, kind of saying, we want to be more like them?
Well, our goal with our partnership with the Mayo Clinic, and I always said this, was to see if we could splice a little bit of the genetic code of Mayo Clinic into the general. And so yes, I would love to be, closer to what a Mayo Clinic is. Obviously, they're a quaternary, hyper-specialized, institution with a ton of research and education, so we would never be that. But I think my other answer is that while you have that model out there as a potential place to enrich your own culture, I believe in homegrown. I believe that if we have local people, local physicians who are thinking about that patient and the family, that we can do it better than somebody from another place. That has been my plea to the board, and the board has responded in the affirmative that yes, we want to be Baton Rouge General, not something else, and so partner where it makes sense, and the partnership with the Mary Bird makes a ton of sense. The partnership with the Mayo Clinic makes a ton of sense. Yes.
shortage of nurses, but did I understand you correctly, the educational system for more nurses is overflowing and loaded up?
No, it's actually not overflowing. It's overflowing with applicants, but it's not overflowing with graduates. There's a bottleneck there, and that's what my answer to the question was. Some of it is regulation, and some of it is additional resources to make sure that that pipeline is open. Obviously, these are highly paid jobs with benefits, and by the way, it's why we're partnering in Mid-City with Park Elementary, because we want to develop that area, and these kids need choices beyond what they have right now, and the opportunity to work with a hospital and be able to get introduced to it and then be able to work at it later after you graduate, I think it's phenomenal. And these kids are going to study there, and eventually, hopefully, they will live there and they will work at a healthcare facility, hopefully at Mid-City, but anywhere in Baton Rouge. And that in itself will be a shot in the arm for the Mid-City, North Baton Rouge area. Yes?
Places like Northwestern, which has an RN program, they're overloaded and packed and
I don't think,
push them out the door?
I think they're doing, all schools throughout the nation are doing the best that they can in terms of the production of nurses. But if, at the General alone, we probably have anywhere between 50 and 100 openings at any one point in time for RNs. The Lake probably has a couple hundred, maybe more. Ochsner has another 50 or 80. The deficit is that's just the hospitals. And then you talk about physician offices and the rest of it. It's a big deficit. Lenny.
Infectious diseases have always been kind of second string compared to a lot of investment in medical research and hospital activity too. Obviously, infectious diseases have become a huge issue for us right now. Is that going to change the structure of things going forward?
I'm going to answer first at a very micro level. It is not easy to get infectious disease physicians, and we finally recruited an infectious disease physician at the General after years of trying. We work very closely with the infectious disease team at Our Lady of the Lake. During the pandemic, there was a tremendous amount of collaboration between not only infectious disease but pulmonary, critical care, nursing. I mean, this was truly a citywide effort. And so, in that sense, the pandemic broke a barrier, and that's more at the macro level, a barrier of collaboration between institutions that was, I think, that was beautiful. It was beautiful to watch. And I think all the work that we did by having the health district founded and all the members meeting, and that's a credit to Baton Rouge Area Foundation for dreaming that the hospital CEOs could get together in a room to figure out how to collaborate. But the fruit of one of the fruits of the health district was the ability for all of us to get together to solve common problems. And I think the support that the Mid-City Hospital received from all the hospitals in the area in terms of making sure that we were getting patients and we were decompressing the emergency room. So that is a significant change, and that's here to stay. And so that was very, very, very good. And I think going back to and then going at a greater macro level, I hope the state and the federal government learned from the pandemic and all the waves. How far do you apply certain measures that are damaging to our economy and to our kids is important, and let alone mental health and and the rest of it. How quickly we push out testing, and some of the fumbling that happened at the federal level with the first wave of testing that came out that was wrong, and or that was actually not wrong, but it just technically they weren't making them correctly, and then the push to get private enterprise more involved in the development of the testing. The COVID vaccine, I continue to say that it was a miracle of science, how quickly it got developed, and how quickly it was rolled out. We can criticize a lot of different things here and there, but the reality is that it was available and many people got the vaccine, and those people, particularly if they were vulnerable, were able to survive. So I think all of these are really, really important lessons of how you deal with with an emergency like a pandemic. And again, hopefully we learned a lot from it. Yes.
You talked about avoiding duplication of services between the cancer services
Mhm.
at Pennington and Marysburg. Could you elaborate on that a little bit?
The question was, what are some of the sort of the back office areas in which we're trying to avoid duplication between the Marysburg Perkins and the Pennington Cancer Center. Some of the obvious ones are IT, billing, sort of back office stuff, but some that are not as back office and not and some that are a little bit front facing for the families is, for instance, everything around nutrition, social services, support, and all of that. Not long ago, Cancer Services merged with the Marybird, and now we're going to have access to Cancer Services, which we didn't for a while, and so that it is one obvious opportunity to not duplicate. There's an opportunity to work closer together on cancer registry. There's opportunity to work on clinical trials. So all of these things that instead of each of us having an infrastructure to manage those activities, we're going to be able to collaborate a little bit better, maybe save some labor in the process of doing that, and enhancing the service to the community.
I was really also interested in services. Is Marysburg going to specialize in a certain area of cancer, and you will specialize in another area of cancer, or y'all going to overlap?
The question is which areas of cancer care Marybird will specialize in and which ones the general. First, I tell you the most obvious one. We are an inpatient facility. When those patients need to be admitted, they will be admitted at the general. When the patients need surgery, they will have surgery at the general. So that is at the most basic level the sort of the way in which we're specializing. And then on the outpatient piece, we both have radiation oncology, different machines. But for the most part, some areas they're more specialized, and some other areas we're going to be more specialized. And the physicians are going to collaborate to make the decision in terms of what's the best location for the care. There may be patient preference. Some people may be very partial to the Pennington Cancer Center, and they only want to be treated there. And so we'll offer that, and others are going to be wanting to be treated only at the Marybird. But the idea, again, is that we're collaborating with that. And then the medical oncologist is the same group that is going to be servicing both clinics. And so, again, they will have a choice of where they want to practice, and the patients will have a choice of where they want to receive their infusion, for example. So, thank you.
First of all, I was born at the Baton Rouge General on Government Street. So am I too old for nursing school? Second, as a hospital administrator, this may be a little outside your field, but do you see the ACA working better and bringing more people to health care?
So the question was whether the ACA was, it's helpful to bring additional patients and closer to, to getting their services. And I, as an administrator, I have this, two-sided argument because, I'm much more free market oriented in my approach, but at the same time, I know that if the government is going to get involved in the process, maybe there's a better way of doing things versus other ways. So I think overall, if I look back over the last several years, I think the ACA was good. I think it allowed for Medicaid expansion that we wouldn't have been able to do that before, and that reduced the charity burden of a lot of hospitals, and it opened up a marketplace for private insurance for folks that wouldn't have been there otherwise. I'll give you an example. My parents are from Venezuela. They recently migrated. They got their green cards, but they don't qualify for Medicare. They're staunch Republicans. And I told them, you all know that what you have is Obamacare. He goes, no, I'm paying my premium. I said, I know. You're paying a premium because it's a private marketplace that exists, because it was created. And obviously, the Trump administration tried to undo it, but in the it was still, it's already part of who we are. And I think overall, my assessment is that it's been very positive. And I'm sure we have nurses who would be more than happy to take care of you.
Okay, Edgardo.
All right.
Thank you very
All right.
much.
Thank you. Thank you.
Next week's speaker will be State Representative Vincent Pierre. So hope all of you can come back. Thanks again, Edgardo, and your staff that came today.
He just got a look at, head of black collar. He's just a look.